They never told you.
Well, they never tell anybody.
They removed you for not going along with whatever the tech narrative is, because tech clearly has a censorship agenda when it comes to COVID, in terms of treatment, in terms of whether or not you are promoting what they would call vaccine hesitancy. They can ban you for that. They can ban you for, in their eyes, what they think is a justifiable offense. And they're doing this, and I don't know who these people are that are doing this, but they're doing this. One of the most important things about you reading out your history like that is to one of the most qualified people in the world to talk about vaccines.
Well, thank you for that. I think that's so. One way that some people put it is, and of course, since this has happened, I've been contacted by multiple lawyers that are looking at filing a suit, just like Alex Berenson has one against Twitter. And the point is made just what you just made. The point that I think is kind of succinct on this is, if my voice, if there's no merit to my voice being in the conversation, whether it's true or not, whether I'm factually correct or not, let's park that just for a minute. Whether or not I'm right in everything I say, and I freely admit no one's perfect. I'm not perfect. That's one of my core points, is people should think for themselves. And I try really hard to give people the information and help them to think, not to tell them what to think. Okay? But the point is, if it's not okay for me to be part of the conversation, even though I'm pointing out scientific facts that may be inconvenient, then who can be allowed? Whether you're in the camp that says I'm a liar and I didn't invent this technology despite the patents, when there's a whole cohort of that, no one can dispute that I played a major role in the creation of this tech. And virtually all other voices, all these industries, the harmonization of the tech censorship, the interests of pharma, big media, etc., and governments, all being harmonized in their messaging globally. I mean, I travel a lot. Okay, I see the same, and I have physicians coming to me all the time about what they're experiencing. The same playbook is going on every continent. Okay, but getting back to LinkedIn, so this is the first event, and Steve Kirsch intervened, called up a vice president of LinkedIn.
And Steve Kirsch is a tech guy, right?
Yeah, he is. He's a Silicon Valley entrepreneur. Who you may or may not recall that I was on the Brett Weinstein Dark Horse podcast with Steve that kind of lit this whole fire up months and months ago.
That's right. Okay, that's where I first saw him.
Yeah.
Okay.
So he has great network connections in Silicon Valley. He invented the optical mouse. And so he called this vice president of LinkedIn. The guy looked into it. Meanwhile, people started dropping off of LinkedIn in protest. And there was major press articles all over the world. And then they reinstated me, and I actually got a very kind letter. This is unprecedented, a personal letter from this vice president apologizing and saying specifically that they didn't have the talent to fact-check me. And then, therefore, they were going to let me go. Now then, subsequently, I got dropped again, and a phone call was made, and they got put on. In that case, the sin was that one of their fact checkers, because remember this is Microsoft, one of their fact checkers had identified the Atlantic Monthly attack article that was written about me, and concluded that I was an anti-vaxxer and therefore I should not be allowed on LinkedIn. My wife and I have racked our brains about what is likely to have been the tweet that triggered this. And, you never know. The last two that I can think of that went out was one that was in our Substack, in which we referred to a fantastic video that has been put out by the Canadian COVID Care Alliance Group that summarizes all the malfeasance and data manipulation and misinterpretation associated with the Pfizer vaccines and their clinical trials. It's a super video. And, of course, I guess that is interpreted as something that would cause people to become vaccine hesitant. That's the sin in general, is saying things that cause people to become vaccine hesitant. The other thing that I put out immediately before that was a post, a link to a website for the World Economic Forum that lays out their entire strategy for how they manage media, how they're managing COVID-19, and all of their core messaging. It's a fascinating website with links. Those are the only two things I can think of that would meet the criteria. So, my position all the way through this comes off of the platform of bioethics and the importance of informed consent. So my position is that people should have the freedom of choice, particularly for their children, and that in order to appropriately choose to participate in a medical experiment, they have to be fully informed of the risks as well as the benefits. And so I've tried really hard to make sure that people have access to the information about those risks and potential benefits, the true unfiltered academic papers and raw data, etc. And the policy that's being implemented is one in which no discussion of the risks are allowed, because by definition they will elicit vaccine hesitance. And by we, what I'm saying is the FDA created so much grief that the DOD decided the juice wasn't worth the squeeze, and they just dropped that arm.
Why do you think that is? What do you think is going on with the pushback on ivermectin?
So it's not just ivermectin, it's hydroxychloroquine. And just to put a marker on that, there's good modeling studies that probably 500,000 excess deaths have happened in the United States through the intentional blockade of early treatment by the U.S. government. That is
500,000.
500,000. That is a well-documented number. Okay, and it's a combination of hydroxychloroquine and ivermectin. Now, when you ask me why, you're asking me to get into somebody's head. What I can say as a scientist is what I observe. The behaviors, the actions, the correspondence, these bizarre things like, don't you know it's a horse drug, y'all, right, which is amazingly pejorative. I live in Virginia, okay? I can tell you the people around me, I live in a rural county and I raise horses. That was deeply offensive. To use that language in that way. But there's clearly been an intentional push on the list of adverse events. And it's very clear that people that have natural immunity have a much higher risk factor for this whole spectrum of adverse events if they get jabbed.
Even though that's known, there's so many people out there telling people who've just recovered from COVID to get vaccinated.
It is. There is a number of things here that are not supported by the science, I'll say gently. To be less gentle, since we're on the Joe Rogan show, I can speak freely. It's knucking futs. This is just wrong. It's not consistent with the data.
Well, it doesn't make sense either. What we know about natural immunity is that natural immunity, at least according to that study in Israel, which is like, 2.5 million people, I think, they said that it's between 6 and 13 times more effective than the vaccine.
That is 6 or 13 times more effective in preventing hospitalized COVID. It's more like 20 or 27-fold, 27-fold better at protecting against developing the disease. Remember, infection does not equal disease.
Right.
And that's only one of over 140 studies that document that natural immunity is superior to the vaccine-induced immunity. And oh, by the way, as a vaccinologist and an immunologist, I wouldn't expect anything different. Pradesh, as you know, has crushed COVID.
Yeah, could you explain what they did to do that? Because it's kind of fascinating.
It's not clear. What are the drugs? So what they did do, what we do know, and there's some backstory to this that we could go into if you want to, but the observation is there was a decision made. The virus was just ripping through Uttar Pradesh. It has almost the same population as the United States. It's huge, okay? Dense, urban, poor, all the characteristics of the stereotypes of the Indian countryside. And the virus was just ripping through there and causing all kinds of death and disease. And the decision was made out of desperation in that province to deploy early treatments as packages widely throughout the province. And it included a number of agents The composition has not been formally disclosed. It was done in coordination with WHO, and whatever was in those packages was rumored to include ivermectin, but there was a specific visit of Biden to Modi, and a decision was made in the Indian government not to disclose the contents of those packages that were being deployed in Uttar Pradesh, which they're still there. And Uttar Pradesh is flatlined right now. The rest of the world is yelling about Omicron and hospitalizations. Well, South Africa isn't. But Uttar Pradesh is still flatlined in terms of deaths.
So they were visited by someone in the Biden administration? Is that what you're saying?
No, there's a meeting between Joe Biden and Modi.
And you believe that out of that meeting, they decided?
I don't know what they said. Wasn't invited. All I know is that immediately afterwards, there was a decision not to disclose the contents of what was being deployed in Uttar Pradesh.
It's so crazy to imagine that in the middle of a pandemic, there's one place, one area of India that's extremely successful in combating the virus, and they're not going to say how they did it. I mean, that's nuts.
So that's where I kind of, my stance in all of this is to say, here are the facts, here are the verifiable data, draw your own conclusion. What's gone on with Pfizer, if the whistleblower comments hold true, and for instance, the Maddie DeGarry case, this young woman who was listed as having a stomach ache that participated in the Pfizer trials, when in fact what she had was a seizure, and she's now wheelchair bound with a nasogastric tube, one of 1,000 subjects.
This was a 13-year-old girl
Right.
that was a part of the study, and they wrote it down as what?
Gastric distress.
That's literally what it says in terms of the adverse effect? Gastric distress. Like what is gastric distress?
Stomach ache.
That's it. But how do they account for all the other injuries?
They don't.
They don't.
They take her off of the study. They
How is
take
that
her
possible? That's totally unethical.
It is.
Right?
It is.
So
it
who's
is,
signing off on that? How are they allowed to do that?
So a hospitalist, I'm not a hospital administrator. But the numbers are quite large. There's something like a $3,000 basically death benefit to a hospital if it can be claimed to be COVID. There's a financial incentive to call somebody COVID positive. The CDC made a determination in year one. This is why all of our baseline data is junk.
What is the financial incentive to say that they're COVID positive? That's why the PCR cycles are ramped up so high?
Again, you're asking causation.
Right.
I can tell you that the hospitals receive a bonus from the government. I think it's like $3,000 if someone is hospitalized and able to be declared COVID positive. They also receive a bonus. I think the total is something like $30,000 in incentive if somebody gets put on the vent. Then they get a bonus if somebody is declared dead with COVID. Okay, so they have an incentive at the front end to declare somebody a COVID case. The CDC made a determination that they were going to make a core assumption: if PCR positive and you die, that is death due to COVID. And so the extreme example, just to show the absurdity, if the patient comes in with a bullet hole to the head and they do a nose swab and they come up PCR positive, they're determined to have died from COVID when in fact they died from lead poisoning.
That's real?
Yeah.
So they've really done that with gunshot victims,
I don't know about,
victims.
for sure, trauma and other things.
I've seen that said, but I've always thought that's ridiculous. There's no way a hospital would do that.
It's not a question of what the hospital would do. It's a question of med codes.
So the code is set that if you swab that person and you're supposed to swab them.
And you get a positive signal. And
Are you obligated to swab them no matter who they are if they come in with an injury?
I believe it's the common practice. I don't know whether there would be an obligation. That would be a hospital by hospital policy statement.
So that it really is true that if someone has a gunshot wound and they're dying of that gunshot wound and you check them for COVID, and if they're COVID positive and they die, they mark that off as a COVID death.
That is by definition from the CDC. That was a decision that was made early on. So remember, looping back, I talked about the interconnectedness at the board level between Pfizer and Thomson Reuters.
Yes. Okay.
Thomson Reuters has become the fact checker of choice for determining, I quotes fact checker, right? And so we can go into the Facebook lawsuit that recently broke that whole story open. But Thomson Reuters is tied to Pfizer. They have common corporate ownership, and they are the fact checker of Twitter now. They're integrated. Okay, so it's Thomson Reuters is making the decision which has connections to Pfizer, about what information will be allowed to be discussed on Twitter.
That is crazy. That is so crazy to even hear. And I don't know how we ever pull out of this mess. I mean, I think we are at a 45-degree downward angle headed into a mountain. I really do. It's so strange to me that no one's up in arms about this, other than a few people that have been censored, a few people that have these opposing viewpoints that are deemed to be something that can't be discussed.
Well, the observation that I can make, if we follow the money, is that hospitals are incentivized to treat COVID patients. The thing that ties all this little part of this story together, including the suppression through the government of early treatment, hospitals are incentivized financially to treat COVID patients. If COVID patients are being treated outside of the hospital and prevented from going to the hospital, such as the case in the Imperial Valley, where Brian Tyson and George Fareed have saved thousands and thousands of lives of indigenous Latinos that are coming across the border and working the fields. I mean, they're breaking their backs to save the poor. Amazing story there with early treatments. And I guess they're left alone because they're in the Imperial Valley and nobody cares. They're all poor. But in these urban environments, there's all these incentives for hospitals to treat COVID patients. And if people are giving treatments that are keeping those people out of the hospitals, then they're not getting that revenue.
So your speculation, if I just could unpack this, that doctor in Maui who was giving early treatment, you think that the reason why he was targeted because he was directly costing the hospital money because people weren't going in?
I'm not saying I'm saying that the observation is that early treatment keeps people out of the hospital, and that hospitals have financial incentives, including death incentives, financial
to discourage
incentives.
early treatment.
Okay, so let me say this. People ask me, Robert, you're the inventor of this tech. You're a vaccinologist. Why are you speaking out? This was the whole topic of the Atlantic Monthly attack article. Why is this person become a vaccine skeptic?
Did they talk to you?
Extensively. And the 3 days before this thing came out, the journalist, he's a young man. He previously publishes basically on woke issues in the Chronicle of Higher Education. This is his first big article. Okay, he was clearly hired, and they explicitly say the article was funded by the Robert Wood Johnson Foundation, the Zuckerberg-Chan Initiative. Okay, Robert Wood Johnson is the major shareholder in J&J, and Zuckerberg-Chan, of course, is Facebook. Okay, so Facebook and Zuckerberg-Chan have funded this attack article by this guy that normally writes about wokeness in the Journal of Higher Education. And he was totally obsessed over this question. Robert, why are you saying these things? You must have some financial incentive. There must be some reason why you're doing this.
Did you meet with this man in person?
No, just over the phone. Okay, and I told him repeatedly because it's the right thing to do. I get this, this consternation. But see, the thing is, I think I may be the only one that has been involved deeply in the development of this tech that doesn't have a financial stake in it.
Right.
So for me, the reason is because what's happening is not right. It's destroying my profession. It's destroying the practice of medicine worldwide. It's destroying public health in medicine. I'm a vaccinologist. I've spent 30 years developing vaccine, a stupid amount of education, learning how to do it and what the rules are. And for me, I'm personally offended by watching my discipline get destroyed for no good reason at all, except apparently financial incentives and I don't know, political ass covering. There's the high zone tolerance issue. And then there is with the multiple jabs that are mismatched for the current circulating virus. That's akin to repeatedly taking a flu vaccine from 2 seasons ago and hoping it's going to protect against this flu.
Well, that's one of the most confusing things about this push for people to get boosted now with Omicron, because they keep saying with Omicron we need to get, but that's a vaccine escape variant, isn't it?
Yeah, among other things. So do you want to open that can of Omicron?
Well, I want to. What we know so far is, at least Peter McCullough said this, and I believe several other people have said this as well, that the immunity that you may have had to the Alpha variant or the Delta variant, it does not seem to work very well against Omicron.
That's true.
Nor does the immunity imparted by vaccines.
By the way, since we're down this little rabbit hole, let me just say one thing. Peter called me, and he said, Robert, make sure you talk to Joe and make it clear that although I spoke clearly and forcefully about one and done when I was on his show, that was before Omicron.
Yeah.
And so Peter wanted me to make sure that your audience knew.
No, yes, we've actually talked about that because I have several friends right now that have tested positive for COVID for a second time, and that is post that podcast with him. He was pretty sure that if you got Delta, you would never get it again. But I know people that have had honestly, I don't know anybody who had Delta, which was the last phase. I know people who had the original version of COVID who have now gotten Omicron.
From basically European intellectual inquiry into what the heck happened in Germany in the 20s and 30s. You know, very intelligent, highly educated population, and they went barking mad. And how did that happen? The answer is mass formation psychosis. When you have a society that has become decoupled from each other and has free-floating anxiety and a sense that things don't make sense, we can't understand it, and then their attention gets focused by a leader or a series of events on one small point, just like hypnosis, they literally become hypnotized and can be led anywhere. And one of the aspects of that phenomena is the people that they identify as their leaders, the ones typically that come in and say, you have this pain and I can solve it for you. I and I alone, okay, can fix this problem for you. Okay, then they will follow that person through. It doesn't matter whether they lie to him or whatever. The data are irrelevant. And furthermore, anybody who questions that narrative is to be immediately attacked. They are the other. This is central to mass formation psychosis. And this is what has happened. We had all those conditions. If you remember back before 2019, everybody was complaining, the world doesn't make sense, blah, blah, blah. And we're all isolated from each other. We're all on our little tools. We're not connected socially anymore, except through social media. And then this thing happened and everybody focused on it. That is how mass formation psychosis happens. And that is what's happened here.
The Uniform Code of Military Justice specifies court-martial for any officer who sends a soldier into battle.